Health officials are reminding families of the importance of getting vaccinated against the flu.
The renewed calls come after the third death of a child in BC. CTV's health reporter Pauline Chan has more.
Dr. Amir Barmal says influenza was a contributing factor in the deaths of 3 children.
What we do know about these 3 deaths is that they all were among children who were less than 10 years of age. And they occurred in kids who were in different parts of the province.
He says BC typically sees 2 to 3 deaths annually in children from the flu, but secondary bacterial infections, as these children had, can compound the problem.
I think it's important to also note that, a common complication from influenza can be these types of secondary bacterial infections. And so that's also, a contributing factor to why children might have very severe outcomes like hospitalization or death.
I'm heartbroken for those families. And, we hear these stories come in every year.
Jill Promoli knows that heartbreak. Her son Jude, a twin, died in 2016 of the flu.
This year, we're coming up on Thomas and Jude's 10th birthday, and Thomas will turn 10 and Jude won't.
Promoli, who is also a school trustee, launched a campaign called Jude For Everyone, reminding families that they can do something to help prevent influenza. Vaccinations.
So I would always encourage people to have a conversation with their doctor. And I do think it's important to stress that the flu shot is for everyone between 6 months and up.
We have seen a lot of respiratory tract infections in kids in the last couple of weeks and months, more than typical. Tons of COVID, influenza, respiratory syncytial virus, RSV.
Toronto pediatrician Dr. Dina Kulik says vaccinations are safe and effective, but if your child does get ill,
if your child is less than 2 months of age and has a fever, or if your child has difficulty breathing, they're not able to drink at all.
These are symptoms that should prompt a visit to emergency. Pauline Chan, CTV News.